what we factored in is, I think, very familiar to a lot of folks. A lot of it has to do with the prevalence of COVID-19 in our regions. So one of the things we first have to look at is what are the regulatory requirements to restarting. Most people are aware that we had a lot of relaxation of some CMS guidelines and some JCO guidelines, and each of our states is very different. I like to show a map of Pennsylvania, and really it just shows it's sort of a model for the country. That our county map looks very, very different in our southeast, our northeast, our west, and our central regions. There's no one size that fits all for the country, and Pennsylvania is exactly the same way. Our health system really spans from the northeast, which a region which abuts northern New Jersey and New York, where they had the highest prevalence in the country, if not the world, to some very rural areas that had one or two cases. So we have hospitals in all those regions, and trying to reopen elective surgery in clinics as well in an environment like that was very complex. One of the things and the state didn't give us a lot of guidance, but one of the bits of guidance they gave us are really two things. They want us to make sure that there was a sustained reduction in the rate of new COVID cases for at least 14 days. The second thing, in addition to a trend, is the prioritization system for scoring. The American College of Surgeons very early on published a prioritization system that wasn't real functional at the end of the day. It was theoretically very nice. It came from the University of St. Louis. It suggested a tiering system with multiple sublevels of tiers based on the clinical condition of the patient. And what we learned were there's a lot more factors that go into that. We really simplified it. We actually turned it upside down. The ACS system suggested that tier 3 were the most urgent cases. That was counterintuitive to most of our providers. We worked with it for about 4 weeks. We got so much pushbacks from providers saying, why is tier 3 the most urgent? Tier 1 should be the most urgent. And so finally we turned it upside down. But we tried to keep it simple.